let's touch on engorgement first. Engorgement, most moms, majority of moms will experience engorgement at least at some point during their breastfeeding journey. Engorgement is extraordinarily common right at the phase where you are transitioning from colostrum to mature milk. So that transitional phase that usually starts occurring anywhere around 3 to 5 days. You'll notice your breasts are maybe a little bigger, a little heavier, maybe a little tender. And that's when your milk is just changing. So you had smaller quantities with your colostrum, and now you're going to large quantities. Your milk's coming in, and therefore you are engorged. Engorgement is basically when either when your milk first comes in, or when milk has sat in your milk ducts for too long. This is called milk stasis. And now you are experiencing maybe a little tenderness, redness, feels like you have hardness to your breast that wasn't previously there. There's lots of circumstances where engorgement can happen. So when we are dealing with engorgement, a couple things can kind of go on. I'm going to start this off with, it's really important that we actually avoid engorgement as best as we can, because it is essentially the first step to mastitis, which is definitely something we want to avoid. So engorgement is very common to happen when you start going longer periods without either pumping or feeding your baby, basically expressing your milk. This can be for a lot of different reasons. So maybe your baby was previously in the newborn period and they were eating very regularly, maybe every 2 hours, and then suddenly they slept for 5 hours. So that's 3 hours longer than you normally feed, and you're likely to feel some engorgement. Sometimes you can actually feel like little hard rocks of sorts. When I was engorged with my kids, I always felt like a rock in my breast. Is the way that I described it. I know that description is a little different from every mom. But basically that's a good or a usual time where baby just suddenly has longer sleep stretches than normal, and then we didn't pump or we didn't feed the baby during that time, therefore we're engorged. Another common time is when baby starts sleeping through the night. I know we really, really love that period, but that is definitely a time where you would likely be engorged. That's where you kind of hear the stories. Oh, I woke up in a puddle of milk because I was so full. So that's one. When baby starts eating solid is another time where we notice that that's a time of engorgement. And maybe when baby is a toddler and they have these really short feeding sessions where they'll feed for 3 minutes, with their foot up in the air, and then run around and come back, and do that on and off. So those are all times that's very common to experience engorgement. It's really important to avoid this because, like I said, it's the first step to mastitis. So when the milk sits in your milk ducts for too long, it will basically become, full. And then if it stays full for too long, then you're going to first develop a clogged milk duct. That's basically where a portion of that milk that is stuck in the milk ducts and they're full, they're gonna harden a little bit, and you can actually feel, if you were to touch your breast, and you can actually feel on the sides like little pebbles or a big pebble, but it's gonna be very hard, and it might be a little red, might be a little tender. And that clogged milk duct, again, if that clogged milk duct stays longer, that's a beautiful common area for bacteria to grow. It is dark, wet, and it's stagnant. That's where bacteria grows. Once bacteria grows, hello mastitis. Mastitis is basically gonna make you feel like you have the flu. It's an inflammation, a breast infection. That is also another thing we want to avoid. So doing what we can to be proactive to avoid engorgement is definitely key advice here. So if you find yourself in an area where baby is suddenly sleeping longer stretches, or you're not able to feed baby as consistently as you were, and now you're engorged, I recommend to express milk. May that be hand express or pumping. Not a full session, but just so you're comfortable. You never want to just leave yourself where you're so full you're uncomfortable. Just express enough to be comfortable. This can also pose a little bit of difficulty with breastfeeding for a couple other reasons. So when our milk ducts are full of milk, it also makes our breasts larger. And basically, this can be an issue because when that happens, that actually starts, our nipples starts to stretch of sorts. So like how pokey they were erect, how erect our nipples are on a usual time when they're not super engorged, will go down. So basically when the nipple itself starts stretching, and then the length of the tip of our nipple starts also stretching, which makes it shorter. And some moms even experience primarily a flat nipple when they are engorged. That can be difficult because when babies are in the face of a flat nipple, some babies have a very hard time latching, which is another reason why we should try to avoid engorgement as best as we can, so we can avoid latching difficulties that follows it. So when our milk is full, our breasts are full, our nipples stretch, they get flatter, and this can be an issue because babies, especially those who are very used to latching onto a pointy nipple and then suddenly they have a shorter nipple, it may cause some confusion. They may not be able to latch as well as they usually do. Therefore, they're not draining the breast, and we're in this little cycle of babies not latching well, babies not draining the breast well, and we're engorged, repeat. So that's a little difficult. And since we're on the topic of nipples, let's touch base on, flat nipples, inverted nipples. So again, it can be a little difficult when, we're trying to latch a baby, and let's say, so this is what usual. This is a normal breast structure. We have an erect nipple, but that's not for every person. Some moms have short or even flat nipples, kind of like this, where they just aren't very pokey outside. The tip of the nipple does not erect much further than the surface of the breast. That can be difficult for some babies to latch onto because, as you can see, there's just really nowhere to latch on during that time. There's a little bit of tips and tricks that you can do to make that easier. And then we have another situation where we have inverted nipples. This is where the tip of the nipple actually, instead of poking out, it pokes inwards. And they usually look kind of smushed, something like that. That's a lot of the inverted nipples I see. You can still breastfeed with short, flat, engorged, inverted nipples. It's just you're going to have to do a little more tricks. You're going to need a little bit more support. So if you have these type of nipples and you're struggling to get your baby to latch, definitely work with a lactation consultant who can help you come up with those tips and tricks to get baby to the breast, even with the difference of a flat nipples, inverted nipples, you name it. So there's basically two types of inverted nipples. So I encourage you, if you see that your nipples kind of poke inwards inside the breast rather than out, I encourage you to do this. This is called a simulation test. So basically, you would go right behind the areola, and you want to do like you are squeezing milk out. This is called the stimulation test. Go ahead and do this for a few seconds and see if the tip of the nipple pokes out under stimulation, something like that. If it starts poking out side of the nipple, then that tells you that is called a pseudo-inverted nipple. It looks inverted, but as soon as there is stimulation drawing the nipple out, it will easily poke out. So that's a little easier for babies because if they can get onto the breast, and as soon as suction starts, it will pull the nipple out. Then we have inverted nipples that are truly inverted. Those are a little trickier and might need some more assistance. Essentially, your lactation consultant is going to implore all the tips and tricks that she can to build positive associations so that baby stays at the breast even without an erect nipple. That could take some time, and that definitely takes some complex education and tricks. So just make sure you're working with an IBCLC level lactation specialist provider if you have true inverted nipples. But some of the things that you can work on, some tips and tricks if you have, a flat nipple, because that is how they always are if it's due to engorgement. Make sure to be proactive about avoiding engorgement when you can, how you can. But if you have short nipples, flat nipples, inverted nipples, this is all something that you could try. So essentially, some babies will latch onto the breast despite the different size, shape of the nipple. Some babies don't have an issue. Some babies do. So we have to pull out some tricks for the babies who struggle. You can still breastfeed if you have, nipples that are not the average perky, erect nipples. You can make it work. You just have to get crafty. So one way that you can do, one tool that I really like and I find extremely helpful, I use them almost always in these situations, and it usually is an easy fix. So this is something that I really, really suggest if you notice that you have flat nipples, inverted nipples, or if you're finding yourself to be engorged more often than you would like and you're struggling with latching, baby. This would be something that I would recommend that you also get. This Jan's also has these. It is a Latch Assist by Lana Chanel. I may have said that brand name wrong. Don't strike me down. But essentially what this is, it's just a little nipple sucker. It's really small, really easy to have around you. But the purpose is basically to draw the nipple out. So if you have short, flat, inverted nipples, this is going to help you make your nipple poke out of your breast more. So if your baby is struggling to latch, this is especially helpful because once your nipple pokes out more, it's easier for baby to latch and grasp onto the tip of the nipple than without. So one way that you can do this, go ahead and squeeze. If you have sensitive nipples, maybe do a half squeeze on this little bulb so it's not too much pressure. And then center your nipple in the middle of it. And here we go. You don't have to have this on for a really long time, maybe 15, 20 seconds. Just long enough time so that your nipple can adjust to the suction and then be erect. And then we can try and latch baby. So once you have it on there, and remember this is a silicone boob, so it's not quite like skin, but it does suction in there fairly well. But in a real boob, this should help erect your nipples more than on their own. So that is a fun little trick that I like and appreciate. Again, this is your Latch Assist tool. Your Jan's Medical Supply should definitely have one of these. They are specifically good when you're struggling to get baby latched to a nipple, and that nipple also happens to be flat, engorged, inverted, you name it. So that is our fun little tip and trick for our today's topic on engorgement and our different nipple presentations. So as always, thank you again for watching this video. I hope that this provided you some education and it was helpful for you. If you watch this as a replay later on, feel free to leave some questions, comments, you name it. We are so happy to have you supporting us, and we hope that this education is helpful for you. If you ever have any questions, you are more than welcome to message me at any time. I'm always happy to help. Jan's is always happy to help as well. So I hope you enjoyed this, and we will see you next week for another Jan's Lactation Series video. Have a good day.